something called GHK-Cu, and this one is really the gold of the peptide therapy world, especially in aesthetics. So I love. Hi, welcome back to the channel. My name is Dr. Amber. I am a naturopathic doctor, and I love to talk about all things peptide therapy and especially how to improve your energy and performance. I love using GHK-Cu for many reasons, but essentially GHK-Cu is a naturally occurring copper complex. It has histidyl, lysine, and glycyl peptides. It's really just 3 different peptides attached to a copper molecule. We know that at about age 20, your plasma levels, so the amount in your blood of this peptide GHK-Cu is about 200 nanograms per milliliter. It's about 200. We know that age 60, that level declines to about 80 nanograms per milliliter, so less than half of what you have at age 20. GHK-Cu is really involved in the production of collagen, which is what keeps our skin healthy and elastic. Part of the process of aging skin when our collagen degrades. Some of the amazing effects of GHK-Cu is it really helps with wound healing. That's how we discovered GHK-Cu. This peptide combination is actually applying it to wounds. So I like to use this in a post-surgery protocol. I like to use it whenever there's some sort of trauma or injury. A lot of women will have either an implant or an explant and they'll have scarring, and so we can use it to reduce that for wounds. Also, it attracts immune cells. It has some antioxidant capacity. It's an anti-inflammatory, which is phenomenal when there is a wound or a cut or a scar. Bruising can be really helpful. GHK-Cu can actually restore the ability of fibroblasts to replicate after chemotherapy. If you know what chemotherapy does, it really stops the rapid division of many of our rapidly dividing cells like hair, and like fibroblasts, which are found in the connective tissue. And so we can wake that system up again by using something like GHK-Cu. We've also found that GHK-Cu, using it for repair and for skin, has found to show a 70% increase in collagen and a 36% decrease in wrinkles. Wow, that's pretty substantial. And GHK-Cu outperforms vitamin C and retinoic acid, which is pretty profound as those are highly used in the aesthetic world topically. Many skincare products actually have vitamin C and retinoic acid. Some of them now actually have GHK-Cu, but we can apply GHK-Cu in combination with these other Botox-like peptides like Argireline and Leuphasyl to get a better result. There's a synergy here. We know that GHK-Cu can have some protective benefits as we age. It can actually work on stem cells. This is really important as the world of stem cells and regenerative medicine is growing faster than ever. And so GHK-Cu really fits into this conversation where we can actually improve the cellular stemness, meaning the ability of cells to differentiate. We can improve stem cells with GHK-Cu, which is phenomenal. Stem cells, if you remember, are those cells that can really turn into anything. So if we need them for connective tissue, we can use them for that, and they can differentiate into other tissues. When we're born, we have a lot of stem cells. That can change as we age. So GHK-Cu can be really helpful for this anti-aging benefit. We know that GHK-Cu can actually activate these DNA repair genes. How amazing is that? DNA damage can happen to all of us, will happen to all of us. We know that GHK-Cu can actually activate this system called the ubiquitin proteasome system, or the UPS system. That system actually removes damaged proteins. So part of the process of keeping healthy, glowing skin as we age is to remove the dead, old debris and to repair our collagen and our connective tissue appropriately. So not only can GHK-Cu help with the repair side, but it can help with the removal of those damaged proteins. GHK-Cu is really this phenomenal option for improving repair, antioxidant properties, protecting against faster aging of cells, especially in the skin. There's a couple forms of GHK-Cu. You can actually inject it. I have injected it myself, and I've found that the injection produces more of a systemic effect for women who are noticing skin changes all over their body and not just on their face. Say they're noticing dimpling on their thighs or issues with skin sagging on their legs or their abdomen. The GHK-Cu injection is more of that head to toe effect. It's an injection into the abdomen, and it can really help with collagen production and healthy antioxidant status in the body. The topical, however, is really good for problem areas like the face. There's also some GHK-Cu in a liquid form that is a dropper that you actually put on the scalp for hair regeneration protocols. We know that faster hair graying can be caused from higher amounts of oxidative stress. And we talked about the benefits of GHK-Cu for really helping to be an antioxidant and quench that oxidative stress. In studies, we found that there's actually larger hair follicles developing around wounds on the scalp treated with GHK-Cu. So it's really phenomenal to use in a hair regeneration protocol, as well as regenerating skin tissue on the face or any other part of the body where there's a scar. The one other consideration with GHK-Cu is that it is a form of copper, and your body has this 2-to-1 ratio, this zinc to copper ratio, and we don't want to have too much copper. It can really cause issues in the body. I find that women who opt for the copper IUD can actually have issues over the long term, because copper can really cause some issues with mood and depression and other issues related to this copper zinc balance that is off. And so I haven't really seen the peptides, even the systemic injectable GHK-Cu form, I haven't seen that cause massive fluctuations in zinc and copper ratios, but it's always something to keep an eye on. And typically I will have somebody taking a certain amount of zinc every day. The RDA is about 15 milligrams per day. Zinc you never want to take on an empty stomach. It will make you nauseous, most forms of zinc. And so having some zinc with food can help to offset that balance. I hope you enjoyed this video about the Botox-like peptides. We have Argireline, we have Leuphasyl, and we have GHK-Cu, that copper peptide. And these three together create this beautiful blend that we can use topically. If you're interested in where to get this peptide, you can actually click down below in the text below the video. We will have a link to where you can access this and read more about it as well. It's a really fascinating combo that is newer to use in aesthetic medicine, and it can be used from home. That's the beautiful thing. Or after skin damage, trauma, a laser, being out in the sun, a sunburn, it can be really, really helpful for wound healing. We talked about post-surgery scars. I tend to use it in those sorts of instances. So go check out the GHK-Cu, Argireline, Leuphasyl, the Botox-like peptides in a combination, or you can get just GHK-Cu, depending on what you're looking for. And then there will also be a link for the GHK-Cu that is for the hair regeneration. That is also over the counter. You don't need a doctor to get that, and you can use that at night before bed, apply it to the scalp. I hope you enjoyed this little clip about the Botox-like peptides, and if you're interested in learning more, you can go to peptideplaybook.com. That is where you can get a free PDF that tells you about some of the peptides that we talked about today and many more. This is just an introduction to the aesthetic peptides. And don't miss our future videos, so subscribe to the channel. This is the Peptide Doc signing off, and I'll see you in the next video.